name's Brigette McKern. I'm 36. Right now I'm mostly a professional patient and I do work part-time as well in a library. And right now I'm just maintaining my health, and I hope to travel more. That's my plan.
Okay.
Well, I live with cystic fibrosis, and that's a genetic disease that affects the lungs and the digestive system. It's a genetic disease, and basically the lungs build up too much mucus. They produce too much mucus, and so bacteria and illnesses can live in there. And so you usually, how it progresses is you just get lung disease. You get lung illnesses progressively. It's hard to get rid of them. So you do things like nebulizers, like asthma patients would do, to break up that mucus. But just over time it takes over your lungs, and you also build up cysts in your lungs. So usually transplants needed at some point. When I was 4 years old, I came down with pneumonia, ended up in the hospital, and that's when they diagnosed me. I had symptoms that I was showing, and they tested me and found that I had it. I was a pretty healthy child. I wasn't in the hospital again until I was an adult, and then it kind of started, my disease progressed, my lungs got worse, and when I was 30, I was listed to receive a double lung transplant. So I waited 2 years on the waiting list and then received my transplant, and that was 3.5 years ago. So now I'm just trying to maintain my health the best I can. I knew I was different from my friends, but again, I didn't grow up with other people who had CF. So for me, luckily I got to be a normal kid. I went to birthday parties and sleepovers, and I went to school, and I had friends, and so I don't think I really thought I was too different. I knew I had to do medications, and my friends, I don't know, I think it was in a way kind of cool for them. They were like, oh, what's your nebulizer machine, or what do you do? And actually everybody was nice. Nobody picked on me or anything. So it wasn't bad. I think as my disease progressed, it got harder, and I kind of wanted that outreach to reach out to other people who lived with my illness to understand it better. I noticed a lot when I graduated college and when I went out to get a job and to work. I didn't really want people to know about my illness. I was worried it would prevent me from getting a job if they knew that I would have to take days off. I would possibly have to be in the hospital at times, and I thought it would be a barrier. So when I was a kid, yeah, it wasn't something that was very visible unless you saw me take medications or something like that. And then as an adult, and my disease progressed, I had a chronic cough, and people, especially working in an office, oh, are you sick? Do you have a cold? And I would just kind of say, oh yeah, allergies, or, I didn't have anything contagious, but I knew it was pretty obvious that I had something wrong, and I would miss days of work and things like that. But then sometimes I think it's easier when people can see it in a way that then they understand. People tend to understand sickness, like when somebody has a visible cold or the flu, and you, oh, I'm so sorry. And maybe if they can't see it, they think, oh, you canceled these plans, you're flaky, or you don't want to come to work, you're not a good worker. And it's kind of that hard place of, you want people to understand, but you don't, because you don't know how it's going to jeopardize what they think of you or what that means to your professional life. When I was listed for transplant, it was a surprise to me that I needed a transplant. It's living with CF, you kind of know, oh, that could happen. And when it did, it just seemed so foreign, and I didn't have anybody to talk to who had been through it. And so I really used Facebook and social media to find other CF patients, other patients who went through transplant, and really seeing other people share their stories. That's what made me want to share mine, because I thought, okay, this person's story made a very big difference to me. And if I could do that for one person who maybe was in my position and felt really lost and not sure what they were going to go through coming up, then it would be worth it. And especially after, if I had to stop working, I was much more open to sharing those experiences, because I didn't feel I would have that stigma of thinking, oh, I don't want people too close to me to know too much. But now I just share it because yeah, just that reason that it meant so much to me that other people shared their stories, and it makes it so much less scary. And just to have one person say to you, I know how you feel, I know what you're going through, like, that makes a world of difference. I remember the day I was told in the doctor's office that, you know, obviously they tell you that you're at end stage cystic fibrosis, meaning without any treatment you probably have a year to live. And lung transplant doesn't cure it, but it can extend your life. And I remember crying because it's very overwhelming, you know, when you think, oh, this means, you know, I could possibly die very soon. And I hadn't had that again growing up healthy, pretty healthy. I didn't think my life would be too shortened. And I was hoping it wouldn't. And then after that, you know, there's about 4 months of testing and evaluation you have to go through just to see if you qualify, because they do, even though you're at end stage, they want you to be as healthy as you can to go through. Actually, lung transplants are considered like the hardest surgery that you can go through physically. And usually each transplant center, they have kind of an average waiting time. And my center was 4 months, but because of my size and the fact that there aren't as many organ donors as we need, I ended up waiting 28 months. And my disease progressed through that time, and I spent more time in the hospital than not. And it's scary because you don't know what the outcome's going to be. I didn't know if I would get a transplant before I passed away. I didn't know how long. You know, when you have like kind of a scheduled surgery, you can think, okay, I just have to make it to this point. And with that unknown, like, I didn't know. So it was kind of, everything came down just day by day. I just wanted to make it through and get to that point. So it's overwhelming. And I actually was diagnosed with depression, major depressive disorder, and anxiety during that time. And I went through talk therapy and was on antidepressants because it was, like you said, just mentally tolling to just take it day by day, you know, and not be able to make long-term plans and things like that, and not to see an end to it coming. But then I also went through it again after transplant, and I felt, I'm not sure how common it is, but coming out of transplant, I felt really guilty. I felt guilty that, like, I had this transplant and there's so many other people that need transplants, and I didn't, you know, you can't guarantee anybody else is going to get a transplant or they're going to be successful. And through social media, I knew people who passed away either waiting for transplants or after they received them, they didn't recover well. And so that's a hard kind of thing to take too. And then also looking at, you know, I have a donor, a person who had to pass away so I could have this chance. And so it's a lot of pressure on you. You know, I want to be the best person. I want to do everything I can now for my donor, for their family, for my family, because my family, you know, my poor parents had to go through that with me as well. So I have friends, and they actually live in Orlando. They're about an hour and a half away. And every time I was in the hospital, they would come and visit me. My fiance, John, he was there as well. Every trip to the emergency room for him had to either drive me there or call the ambulance. And my parents actually live in Minnesota, and they came down. And especially during my recovery, I had to have full-time care for about 3 months after my transplant. And so my parents came down and did that. So a lot of people sacrificed, you know, time from work, time from their social lives. And I know mentally it was hard for them as well. But yeah, I wouldn't have gotten through without them helping me, just not only physically, because I, you know, couldn't breathe and things. So I couldn't cook. I couldn't, you know, I came down to it. I needed help washing my hair, things like that. And then just mentally having them keep me up for every day and getting through really made a difference. It's overwhelming to know that somebody I've never met and I'll never meet, like, literally saved my life. And they made a selfless decision, and their family did before they passed away. And I can't imagine during a time of losing a loved one making such a big decision. And to me, you know, it's been almost 4 years. That's more holidays I've had with my family, days I've had with my friends. I've volunteered, and I'm happy to wake up every day. It's a very overwhelming thing. And I think people need maybe need more education, more facts about organ donation. I think there's a lot of false information or stigmas that are around it. You know, people think if you went into a hospital, they wouldn't want to save your life if they knew you were an organ donor, which is completely false. They always do everything they possibly can. And also that it's something that will come down to your family or your next of kin. So it's important to talk to people around you that you want to be an organ donor, because in that hard time, it could be hard for them to make that decision for you. But if they know your wishes, it might be a little easier. It was great during transplant. I had really awesome nurses, and they worked specifically with transplant patients. So they knew the process and they knew how hard it was every day, you know, just to eat, to get up and walk and all of that. So I actually had really great nurses, and especially because you don't spend a lot of time with your doctor. You spend more time with your nurses. They're there 24/7. So I got to know them and their the stories of their family, and they got to know my family that would come to visit. And so I think that too, reaching out to the staff, to the healthcare, you know, they're there when your family's not there. And I just had really great nurses. I was very lucky. But again, they're kind of that bridge between you and your doctor as well. So it's important for them to know everything you're going through and to voice when you have pain, when you have problems with medications and things like that. Like, be your own advocate and be outspoken. And don't be afraid that anybody's going to judge you, or, you know, I think I went through that, especially as a kid. Like, I wanted to be the perfect patient, and I wanted to come in and I didn't want to complain and that, but it gets you in more trouble when you don't, because then you have problems that you're not taking care of. So I think just don't be afraid to voice anything. Very busy, very scheduled. A lot of the treatments that we do, so the nebulizers, there's also a thing called a vest machine, and it's literally you put on a vest, it hooks up to a machine, and it shakes. It does percussions on your chest to also help break up that mucus. And those treatments are done 2 to 3 times a day, and it can take up to an hour each treatment. So that, along with pills 2 to 3 times a day, it's a very laboring process to take care of yourself, and also frequent doctor appointments. I've had experience, there are designated cystic fibrosis centers at certain hospitals, and I've been seen at those, and I've been seen just at hospitals, and I will say it's very different. The cystic fibrosis centers, they know about treatments, they know how the disease progresses, and generally in a hospital it's not something that's seen commonly, so it can be hard to be properly treated. You can be, the way you would treat infections would be different than with an average person, so sometimes there's a lot of confusion there. It is a very expensive disease, unfortunately. Medications and treatments, the machine I was talking about, the vest machine, most families can't afford it. It's thousands of dollars, and so things like the Cystic Fibrosis Foundation, or you find other areas that can help you, or sometimes people donate the machines when they don't need them anymore because they are such a high cost. Medications are expensive. I mean, my parents both had to work full-time when I was growing up so I could have health insurance, and so it was really focused on when I aged out of their insurance, I had to focus on getting a good job, getting something that I could support myself and get the insurance to pay for those medications. So that's hard too, because a lot of times when you get to adulthood, your disease is so progressive, it's hard to work full-time, but you know, you have to choose what you're going to do. So I worked probably longer than I should have, they told me, but I needed that insurance, I needed that help. So I'm not sure what the answer is, but you know, it somehow bring just down the cost of drugs. Also, the amount of time before a drug can become generic, because a lot of the drugs we take when they first come out, obviously they're patented and they're very expensive. So I think maybe shortening that amount of time and allowing other companies to produce the same things. You know, it's kind of a monopoly with very few drug companies that produce the drugs we need. I would like to tell my story more in person, maybe volunteering. There are LifeLink in Florida's organization that procured the lungs that that were my donor lungs, so maybe working with them or somebody just to share my story to raise more awareness about organ donation and what that can do. So I've been keeping myself healthy and building up that stamina so I can do a little more physically, and that's why social media is easier for me. You know, a lot of times I still have a lot of treatments, a lot of doctor's appointments and things, so it's easier for me to get messages out that way. I think it's up to every patient, because I know there was a time, again, that I wasn't necessarily ready for everyone to know all those details, and it can be very hard. So I think if you feel you're ready, and you can do it in small steps, even just talking to people in your life, your friends or people you work with, and then kind of building up from there. So I wouldn't tell people yes or no. I think it's each person's journey. But just for me, it was very therapeutic, and it helped me kind of process everything that was going on. And also, again, I moved down here from Minnesota, so I had family and friends in other states, so it was easy for me to update them on what was going on rather than having to call all of these people. So, but I would just say, if you want to do it, don't be afraid to take those first steps, even if they're little. Take it day by day and know that you're strong and you're going to make it through it. And don't be so hard on yourself. Don't think you have to do everything yourself. Be okay to ask for help and reach out to people, because it can be isolating as well, and you don't want to feel like a burden on somebody else, but you're not. There's people around you for a reason, and they want to help you out and take care of you.